Good afternoon, everyone. So I'll be presenting a free paper on neurofibromatosis of eyelid and orbit, presentation and surgical management of mechanical ptosis. So there are no financial interests or conflicts of interest. Neurofibromas are common benign peripheral nerve sheath tumors, often appearing as soft skin-colored papules or small subcutaneous nodules. They are composed of Schwann cells, fibroblasts, perineural cells, mast cells in a myxoid influence background. There are three main types of neurofibromas. The localized ones are the most common, followed by diffuse and plexiform type. NF1 is an autosomal dominant disorder and is caused due to mutations of NF1 gene and affects approximately 1 in 3,000 persons. So these are characterized by various features which include cafe-eyelid spots, axillary or inguinal freckling, iris cleach nodules, optic nerve gliomas, and sphenoid dysplasia. The plexiform type is the pathognomonic one for NF1 and it carries an increased risk of malignant transformation. The diagnosis of NF1 is crucial for all clinicians due to its varied presentation, including vision and life-threatening malignancies. So this study aimed at understanding these varied manifestations of NF1 for making an early diagnosis and treating it wherever necessary. So the aims and objectives of this study were to study patients with NF1 with ocular involvement of lid and adnexa and to evaluate the outcome of surgical management for excision of lid mass causing mechanical ptosis. So it was a retrospective case series. All patients' records that satisfied the criteria of neurofibromatosis according to the NIH were included. Exclusion criteria included all those patients with atypical neurofibromatosis, NF2, or any other genetic disorder related to lid and orbital lesions. So 7 patients with NF type 1 were studied for manifestations in eye and orbit, causing visual impairment due to ptosis or amblyopia in this study. Patients diagnosed with NF1 underwent general physical examination, ocular examination, which included a detailed history, visual acuity test, slit lamp, fundus examination, and MRI scan, if done, confirmed the presence or absence of intraorbital and intracranial masses. So the NF1 diagnostic criteria requires at least 2 of the following 7 criteria. We should have at least 6 or more cafe-eyelid macules more than 5 mm in greatest diameter, axillary freckling should be there, Lisch nodules, 2 or more neurofibromas, at least 1 plexiform neurofibroma, or a first degree relative with NF1. So in our study we had 4 families, of which we can see that 3 families had patients or the affected individuals involving 2 consecutive generations. Except for family 3, the rest of the ones were involved. Coming to family 1 now. So it was a 14-year-old male diagnosed with NF1. He came with complaints of drooping of right upper eyelid and multiple swellings throughout his body. He had delayed milestones. There was a history of second-degree consanguineous marriage. Similar complaints were seen in the father. Autosomal dominant pattern of inheritance was there. So here we can see the pictures. That was the patient at 1 year of age, and at 14 years we can see the right eye, the severe mechanical ptosis and the lid mass. So multiple hyperpigmented macules were seen over the face, trunk, and upper and lower extremities, suggestive of cafe-eyelid spots. Bilateral axillary freckling was there. Then yellowish brown raised nodules involving the iris, suggestive of Lisch nodules was there. And S-shaped deformity with a classical bag of worm sensation causing the eyelid to droop was there, suggestive of severe mechanical ptosis. Coming to the radiological findings, X-ray skull AP view showed the bare orbit sign, and there was also this swelling in the zygomatic area. CT brain, soft tissue thickening in the right periorbital and zygomatic region was noted. A bony defect was also seen in the right greater wing of sphenoid, suggestive of sphenoid dysplasia. Coming to MRI brain, small hyperintense foci in the left frontal white matter and left globus pallidus was noted. However, there was no evidence of optic nerve glioma. Debulking of the neurofibroma of the right upper eyelid was done, and mechanical ptosis correction was achieved using frontalis sling surgery with Ethibond suture 50. Surgical excision of the lesion present on the zygomatico-temporal region on the right side of the face was also done. So these were the pre-op and the post-op day 1 images. Histopathological evaluation confirmed the diagnosis of neurofibroma. Coming to family 2. So it was a 7-year-old male with NF1 with congenital pseudoarthrosis and acute osteomyelitis. So he came to us with swelling on the right lower limb since childhood. It was a non-consanguineous marriage. History of NF1 was there in the family as seen in the pedigree chart, and there was pseudoarthrosis. So here we can see the images on my right hand side, the pseudoarthrosis of the right tibia, the bowing of the legs, and the remaining features are also there. So coming to family 3 now, it was a 20-year-old male diagnosed with NF1. He came with dimness of vision in left eye and lesions on skin over the upper back. It was again a consanguineous marriage. On fundus examination, we found a macular nevus and an optic nerve pit. So now coming to family 4, it was a 5-year-old male diagnosed with NF1. It was again a non-consanguineous marriage. History of NF1 in the father. And these are all the images, the cafe-au-lait, axillary freckling lesion nodules, and involving the son and the father. Now results, 3 families had involvement with multiple cafe-au-lait spots, axillary freckling, lesion nodules over iris, and nodular lesions of autosomal dominant distribution. One patient with severe mechanical ptosis due to the lid mass had poor lid elevation and underwent excision of the lid mass and sling procedure using Ethibond 5 sutures, the Fox pentagon method, resulting in significant improvement in eyelid height and function. So this is the pictorial depiction of all the various clinical manifestations. Cafe-au-lait lesion nodules were seen in all the patients, axillary freckling in 50% individuals, one patient with plexiform neurofibroma mechanical ptosis. Coming to the consanguinity, 50%, that is 2 families had consanguineous marriage, and 2 families, there was history of non-consanguineous marriage. So discussion, all the cases in our study met with 3 or more criteria which aligns with the Gunjan et al. Study. A single case of eyelid neurofibroma causing mechanical ptosis was reported in our study, similar to again Neha K et al. Study. And Boring K et al. Found that multiple lesion nodules are a specific indicator of NF1, which was also confirmed in our study as 100% of the patients had lesion nodules. So long-term evaluation of NF1 patients with significant lid or orbital masses needs to be done to avoid complications and keeping in view the possibility of a malignant transformation. Ethibond sutures can be effectively used in children for correction of congenital ptosis or mechanical ptosis with good results in comparison to silicone rods. So these are my references. Thank you.
Thank you very much. What was the follow-up of the patient you did surgery? Debulking.
The follow-up was good, ma'am. There was improvement in the lid height, and the patient is doing well now.
Long-term follow-up means recurrence, etc.
No, ma'am. No recurrences.
How long did you follow?
2 visits. Then we lost to follow.
2 visits means how months? 6 months?
Like
1 year?
2 months and then 4 months.
Okay.
Hello. Okay, so when you were exploring during surgery, what type did you find? Is it plexiform? Was it easy to dissect?
It was quite superficial. It was not the dissection could be carried out.
So which is the most difficult one to dissect?
The plexiform.
Because it goes along the
yes,
nose, so that will decide whether it will come back or not.
Yes, ma'am. True.